Hi, this is Leonard Kish with HealthIT TV. I'm pleased to be here with Dr. Patrick Shiong, the CEO of Nanthealth, who is, many have heard, has a very, very ambitious number of projects underway to reinvent cancer care, among several other things. So, Doctor, what prompted you to start such an ambitious project? And tell us a little bit about all the initiatives that you have going.
So the Cancer Moonshot program is really to try and reimagine how we're going to give treatment for cancer patients. So this started in 2005 for me, when the drug that I developed called Abraxane, where the drug, people to this day don't appreciate, the basis of my developing that drug was to actually enter into what I call the tumor microenvironment. And by that time we realized that the cancer was moving so fast that what we were thinking about in cancer before was completely wrong.
Right.
We thought cancer was a single clone, it's thousands of clones. So which means that we need to sort of interrogate the cancer not at the genomic level but at the proteome.
Right.
So that we had to invent this test called GPS cancer that could interrogate the cell and understand what the cancer cell is doing. Ironically, we have been giving trial and error recipes of chemotherapy, which actually kill one clone but actually activate another.
Right.
So it's like a losing battle from day one. It was almost futile and we've lost the war.
Right.
If we however understood which proteins were active in real time before we started treatment, and then anticipate that, and then give immunotherapy, activate your own immune system, we could completely change cancer.
Because on an ongoing basis, I mean, all of us have cancer cells in our body, but our immune system naturally disposes of them. So our immune system is relatively good at that. So this is a method of enhancing that even.
Well, it's exactly right. Most people don't realize we're generating cancer cells today, every day.
Right.
So you own your cancer in a sense because your genome sequencing, your genome, your body of regeneration is a physiological mechanism to keep you alive. And the beauty of that, unfortunately, in that process, certain cells go haywire because of the complexity of the replication of the genome. But the reason you don't get cancer is because you have these things called natural killer cells, dendritic cells, T cells that survey the body until the cancer gets smart enough and actually turns all these off and teaches the body to believe and tricks the body that it's a good guy.
Right.
But this cancer cell is basically your cell and it's hijacked all the machinery. So it's not a single simple thing of saying, okay, it's just one treatment. It's hijacked all elements of your machinery. So the only way to know which machinery it's hijacked is to do a test that actually looks at what I call a molecular MRI. Take the tissue, take your normal, compare it against each other down to the protein level and figure out what is hijacked. Once we know that, then we can actually then treat this patient based on activating the cells that actually now asleep. And you can do that with a vaccine, just like you can do a flu shot. Giving you more natural killer cells that's been put to sleep. You can do that with a blood transfusion.
I assume there's going to be thousands of different vaccines.
Well, that's exciting because that's what I call the whole idea that what vaccine do we give you? Well, you have generated your own mutation based on your own human genome that you were born with. So that's why this test of GPS cancer. But so we got to give you the vaccine, but then we got to monitor you. And in order to monitor you, we need to capture your vital signs. That's why you see we've got 80 billion vital signs we've captured.
We so need to really have the full context of the individual and what's happening with them.
But then you go see your specialist and they put your data into electronic medical record. So we need to integrate all the electronic medical records and the images. And then you come back 3 weeks from now and you get to treatment. Then we actually look at the outcomes when you're at home. So we have the systems to monitor you at home. Then we actually have to re-biopsy and do this test, but have the results back in time for the next treatment. So that's why I said what Nanthealth is doing is actually tracking, treating, and chasing at the speed of the biological clock of your cancer. That's what we do.
That is a massive undertaking.
That is a massive,
and a massive amount of integration. And we're here at HIMSS, which is they call it the Super Bowl of HealthIT conferences. How can you do that integration where so many others have failed on so many levels?
Because we looked at it from 2005 as the mission. The mission was not to create any little device, or if you look at this HIMSS, 3 years ago it was population health management.
Right.
This year it's precision care.
Right.
But it's all these little silos or little pockets,
Right.
everybody chasing after their particular product.
Right.
We are not interested in a product. We're interested in a mission with the patient at the center,
Right.
and a treatment and an outcome. So I'm a surgeon. I want to actually do something on behalf of that patient and create a decision that is the right one as best as I can, with as much information as I can before treatment begins.
And not even down just the individual, but down to the cell.
Down to the cell.
proteome.
And that's why I'm so proud we just won this show #1
Clinical decision support.
Now you ask, what's that all about? Well, that clinical decision support came about by integrating the diagnostic, the electronic medical record, the imaging, the data, and this event-driven engine that we just brought in from Nanthealth, that is a portal between
right.
the payer and the provider. And to us, a non-event is an event. Let me explain that to you. A provider sees a diabetic patient but doesn't order or charge for a diabetic test.
Mm-hmm.
We'll be able to pick that up and inform the provider, wait a minute, you need to do a hemoglobin A1C
Right.
on that. So that's what I mean by chasing the data
Right.
on behalf of the patient at the speed of their biological clock.
Right. And so is this related to the precision medicine initiative that the White House is...
Well, there's two, right? There's a precision medicine initiative at the White House by Obama and Francis Collins, and then there's the Cancer Moonshot program that Vice President Biden and I
Right.
had sort of been talked about since October 2015.
Okay.
The precision medicine initiative, as I understand it, is to take the genomic sequencing of normal people, archive it, and look at it 4 years from now. I'm not too sure what kind of data you can get out of that, because, and I can't speak to that because I'm not involved with that.
It's population-based versus individual-based.
Yeah, GWAS type of thing that they
Right.
call GWAS.
Right.
I think that'll maybe give you good basic science data. I'm a clinician.
Right.
I'm interested in the patients that are sick now and
With the
today.
individual.
So what we're doing on the other hand is actually treating patients as they have the disease in real time, and treating it at the molecular level. And we have leapfrogged the genome. So the Precision Medicine Initiative, as I understand it, is the whole genome sequencing. Our test is whole genome and proteome RNA-seq down to the quantitative proteomic level, because that's where the drugs are treated.
So how early on would you do detection? I mean, there's always a trade-off between early detection but then over-treatment, but this is very precise, obviously, so what's your vision for how early you would start looking at these things?
One of the most exciting things we're working on now is head and neck cancer is one of the fastest growing cancers in the United States, hard to believe, because 2% of us has HPV in our tonsils. So we now can be able to test these patients and generate a vaccine, not to prevent HPV, but to prevent the cancer generated from HPV.
Well,
So that's how far early on we can go and truly create a potential preventative test, not preventing the cancer, but preventing the metastasis or the cancer to occur.
And the HPV vaccine has already shown really great results.
Yeah, so the opportunities now really exist at the immunotherapy. So that's what the Moonshot is about. It's to take genomic, proteomic sequencing to its nth degree, integrate that with big data, which is what Nanthealth is trying to do, tie that to combination therapies, and drive evidence-based, quantifiable care in real time.
So the last question, how do you pay for all of this?
Well, you pay for this by actually reducing cost.
Right. So it's driven by value-based care, then?
Completely value-based care. But what is value-based care? Value-based care is outcomes.
Non-fee-for-service.
Well, yeah, exactly. But how do you account for it, right? So it's accountable value-based care is really outcomes divided by cost.
Right.
So you need to measure outcomes in real time. You need to measure cost in real time, and that's exactly again what Nanthealth does. We are the first tool called HealthIT that can not only look at the protocol it's given, but the cost, and then measure the outcome relative to the cost. So that's why Nanthealth is exciting, because it can now work with the payer and truly drive value-based care.
Yeah, cost benefit. Great. Well,
Okay.
thank you so much,
All right.
Doctor. Pleasure. This is Leonard Kish on HealthIT TV at HIMSS 16. Thank you.